So now talking about issues as we age, these UV photos show hidden sun damage. Sun damage is accumulative, so it's going to increase as we age, and more sun damage puts you at a greater risk for skin cancer. So you can see each of these photos, and then you can see the sun damage UV picture next to it. So it may look like there's not a lot of sun damage on the surface, but when we look at the photos, we can see a lot more. So skin cancer. Skin cancer is abnormal growth of skin cells. It could be a benign form of skin cancer. Benign means it's encapsulated. It means that we've got these abnormal cells growing, but they're not spreading through the body. They're staying localized. Malignant means that it metastasizes or spreads. So these abnormal malignant cells will grow and potentially spread to other parts of the body, which means the cancer can then start to grow in other locations. Main causes of skin cancer is UV radiation. It could also be caused from repeated skin irritations, infections, different chemicals. Your body has different protective mechanisms to try to prevent this. Melanin, like we talked about, forming that shield so that the ultraviolet radiation cannot get to the nucleus and damage the DNA. Apoptosis is programmed cell death or cell suicide. So if a cell has been damaged, it could go through this process where it basically kills itself. So then that damaged cell isn't going to create more damaged cells in the future. And there are some DNA repair mechanisms. DNA has a proofreading system where if it notices that something's wrong, it does have some abilities to go in and try to fix those areas that have been damaged. There are many different types of skin cancer. The three main types are all keratinocyte cancers. So we've got basal cell carcinoma, which arises from the stratum basal or the bottom layer of the epidermis. It can invade the dermis and hypodermis, so it can grow downward. It's the most common form of skin cancer. It's very slow growing and very little malignancy. It's pretty common to be able just to excise this or remove it, and then it's gone. Squamous cell carcinoma arises from the stratum spinosum, so a different layer of the epidermis. This has rapid growth and it can metastasize. So this one's a little harder to treat. You would probably need excision as well as radiation, potentially chemotherapy. And then we have malignant melanoma. This is cancer of the melanocytes. And this has extremely rapid growth and rapid metastasization. So this will spread very, very quickly. It's very difficult to treat, and it's one of the fastest growing kinds of cancer. We're seeing this much more commonly in the population. So here you can see the differences between the three kinds of common skin cancers. Now, going back to melanoma, there is something called the ABCDE rule. So if you have a pigmented area in the skin, these are the things you want to be watching out for. Asymmetry, where if it doesn't match on two sides, that could be a warning sign. Border regularity. Color, specifically multiple colorations or if it changes color. A diameter, especially if we're noticing that it's getting larger in size. And evolving. So Kind of like we mentioned with the changing color, the changing size, any other changes you notice is always something that could cause an alarm. So here it's just showing benign or normal on the top, and then asymmetry for those 5 characteristics on the bottom. This is just going through some different treatments. Treatments for skin cancer will depend on the type of cancer and the location, how far along it is in its growth, those sorts of things. And then these are just some interesting facts about skin cancer that you can look at on your own. Another issue that has to do with the skin are burns. And most of you have had a burn at some point. A burn is when there's tissue damage and cell death caused by things like heat, electricity, sunlight, chemicals, radiation. So there's many different causes of burns. The 2 main complications are infection and fluid loss, which could lead to dehydration. First degree burns are what most of you have probably had. These are very common burns and they're very minor burns. Only the epidermis is affected. It results in redness, swelling, and pain. But usually no real treatment is required. The body will heal these on its own. Second degree burns are a little more severe. They involve the epidermis and the epidermis. And what usually distinguishes a second degree burn from a first degree burn is that second degree burns usually have blistering as one of its side effects or symptoms. Again, the body can pretty much heal these on their own, but with blistering, you just want to make sure that you're watching for infection, because if that blister then pops, then you can expose that healing skin area, which is further down on the skin surface, to infection. Third degree burn is when all 3 skin layers have been burned. So we're gone through the epidermis, the dermis, and we're even burning the hypodermis. Depending on the severity and depending on the type of burn, it could be whitish, it could be reddish, or it could be black. A third degree burn often has no initial pain. And that's because the nerve endings have been so damaged from the burn. As the healing process takes place and those nerve endings are starting to regenerate, then they can be excruciatingly painful. There are 4th, 5th, and 6th degree burns. Those are not as common, and those are usually met with more complications, and the prognosis is usually not as good with these sorts. Oftentimes, 4th, 5th, 6th degree burns will result in death. So, skin burn treatment. First, second degree burns usually aren't too bad. Third degree burns, you usually want to make sure that you're getting some sort of care for those. With burns, there's something called the rule of nines. And this is really for medical professionals to assess the amount of burned area. And you only use these with second and third degree burns. It helps guide decisions about treatment because not only is it the severity of the burn, but the amount of skin surface that's been damaged. So if less than 10% has been burned, that would need to go to a burn center. If less than 20 to 25%, it would require significant IV fluids. And anything around 30% or higher, you're at high risk of fatality. And so you can see how the body's broken up into nines to determine how much body surface. It allows a quick estimate of how much body surface is actually damaged. So For severe burns, usually these are third-degree burns, there is a bunch of different treatments. First, the burned, damaged, dead tissue has to be removed. And this allows healing while preventing more damage or infection because we don't want that damaged tissue to start to decay or get infected or cause more problems. And this may need to be performed multiple times during the healing process. It's extremely painful during this process. Then skin grafting often needs to take place. And there's two different kinds of skin grafting or skin transplantation. There's split thickness, in which we take a piece of the epidermis and part of the dermis. So we're taking skin from a different location. It's then processed with something called a skin mesher. And that can take a small amount of epidermis and dermis and cause it to, we can expand it to 9 times the size. So we can take a small sample and expand it to be able to cover a larger surface. The donor site heals from the dermis, and then it could be reharvested in 6 weeks. So we can reharvest the same area after it's been healed. Full thickness is where we take the epidermis and all of the dermis, including all of the blood vessels. The donor site either has to be sutured, so you have to actually close up that area, or you may need to do a split thickness graft to cover where you had to take the graft of full thickness. So in a split thickness graft, they are going to take a piece of skin. And so here you can see they use a special machine to be able to take a piece of the skin. The skin is then meshed, and that's when it's able to be spread. And then the skin and mesh are placed over the wound and stapled in place, like it's done here. And then you can see the healed burn after a year. And then where they took the graft from, that's just going to heal on its own because it's only the epidermis and a small part of the dermis. In a full thickness graft, this you're going to take dermis and epidermis along with some of the blood vessels in the dermis, and then you are going to put it onto the area that needs that graft. And then from the area that you took that large donation, you'll probably need to do a split thickness to cover that.